to National General Accident and Health's Dental Indemnity video. In this video, we're going to go over the dental indemnity's plan design, the eligibility requirements, what it takes to enroll into this dental product, and any post-sale information you or your client may need after the product is purchased. So why dental? Well, healthy teeth lower overall healthcare expenses. It also catches small problems before they become big expenses. More than 1 in 4, 27% of adults in the United States have untreated tooth decay. Nearly half, so 46% of adults aged 30 and older, show signs of gum disease, and severe gum disease affects 9% of adults. National General's dental indemnity product is a fixed dental product that pays set cash benefits per covered procedure. There are 3 levels available: basic, intermediate, and plus. It is guaranteed issue, and there are no deductibles or network restrictions. And there is a network savings card option available to add on to this product. The 3 plan levels are basic, intermediate, and plus. The benefits are divided into 3 categories: preventative services, basic services, and major services. For preventative services, for the basic plan, your client would receive $75 per visit, up to 2 visits per year, as long as they're separated by 150 days. Now this is per person on the plan, so no matter what the cost of the service, for the basic plan, your client would receive that $75. For the intermediate plan and the plus plan, the benefits are a bit higher at $100 per visit per person. For basic services, your client would receive a benefit based on what the procedure is. These are services like general anesthesia and fillings. For the basic plan, your client would receive between $25 up to $200 based on the procedure, where the intermediate and plus plans, the benefits are $50 to $400. Now with the basic and major services, your client would receive 50% of the benefit amount the first year, and every year after, they would receive 100%. For major services, like bridges and crowns, the basic and intermediate plans do not pay benefits. If major services like these are important to your customer, the plus plan would be the best fit. For the plus plan, your client would receive between $20 and up to $1,000, again based on the procedure. There is a 180-day waiting period on the benefits that fall under major services. For the rest of the first year, so day 181 through 365, your client would receive 50% of the benefit amount, and every year after, 100%. The annual benefit limit on these policies varies per policy level. For the basic plan, it's $500 plus the $275 preventative visits, meaning your client could receive up to $650 in benefits per person for the basic policy. For the intermediate plan, it's $1,000 plus the 2 $100 visits for preventative, so $1,200. And on the plus, it's $1,500 plus the 2 $100, so up to $1,700 per person. Here are some examples of benefits and the different levels. For an amalgam filling, 3 surfaces, for the basic plan, your client would receive $70. Keep in mind, for the first year, they would receive 50% of the benefit amount, so $35. On their intermediate and plus plan, they would receive $140. Again, on the first year, $70. For an extraction, a ruptured tooth or exposed root, on the basic plan, your client would receive $50, and on the intermediate and plus, $100. Now for major services, you can see that none of them are available on the basic and intermediate plan. For the plus plan, for an inlay metallic tooth surfaces, your client would receive $300. For a crown resin, your client would receive $450. For complete dentures, your client would receive $375. Keep in mind, preventative benefits do not take away from the annual maximum benefit amount. You do have the option of adding a savings card for dental and vision services. This card is $3 per person per month and provides discounted pricing on dental services from network providers, and this savings card price is only available when purchased with our dental plan. It also gives your client access to both VSP and iMed Vision networks. It does provide an average of 42% savings on services when they use network providers, and the discount applies during waiting periods on both covered and non-covered services. The dental network on the Network and Vision Savings Card is Carrington Maximum Care Dental Network, which is a combination of Care PPO, Care Platinum PPO, and DentiMax, aiming to make a nice neighborhood dental network. When clients purchase the savings card and use network providers, they will save on average 42% on services including routine oral exams, cleanings, evaluations and x-rays, and major work such as dentures, root canals, and crowns. Let's take a look at a benefit comparison. On the left-hand side, it will be the benefits using the network savings card. On the right-hand side, it'll be without. Both of these examples, we're going to be looking at a filling that costs $198. With the network savings card, the cost after the network discount is $137. The plan will give your customer $75, leaving the customer's responsibility at only $62. Now without the network savings card, the filling costs $198. The plan will still provide your customer $75, but then your customer would be responsible for $123. The vision benefits on the Network and Vision Savings Card provides your clients access to the VSP, Vision Savings Pass Vision Program. Your client will receive a $50 rate for eye exams, 15% savings on contact lens exams, and special pricings on complete pairs of glasses and sunglasses. Your client will also have access to iMed, Vision Care Access Plan D discount program through the Access Network, where they would receive 20 to 40% off retail price on eyewear. They are also eligible for discounts on exams, eyeglasses, and contact lenses. In most states, your client can apply for coverage up to age 70, and the plan is renewable up to age 75. There are a handful of states where the age limit is 64 and renewable to 70. On this product, you can write child-only plans. National General's dental indemnity coverage is available in the states in yellow on the map in front of you. There are some exclusions on this policy, such as procedures before the effective date, dental professionals, cosmetic surgery, orthodontics, services performed outside the United States and territories and Canada, and military service members. Now this is not a complete list of limitations and exclusions. You can refer to the brochure for a more comprehensive list, but always refer to the policy contract for a complete listing. This dental plan's effective dates can be as early as the very next day. The initial payment is drawn at time of application, so when you press submit, the payment is processed. Recurring payments are 5 days before the monthly anniversary of the effective date, and the acceptable forms of payment are EFT from checking and savings accounts, as well as Visa, MasterCard, or Discover. When enrolling to any plans from National General Accident Health, your client must do a final attestation. You have two options to help your client attest to their plan: e-signature or voice verification. E-signature is by far the easiest. When you press submit on the application, your client will receive an email. This email will ask your client to create an account on the member portal, VIPmemberbenefits.com, and from there they will be prompted to read the authorizations and e-sign their policy. It takes just a few minutes. With voice signature, it takes a bit more time. The instructions for voice signature will be presented at the end of every application, and the steps needed to be followed exactly as presented. You, with your client on the line, will dial into the voice signature line, read the authorizations, and have your client agree. The recording is kept as verification of agreement to enroll. E-signature is much easier, but the voice signature option is there if needed. Your client will have access to the member portal, VIPmemberbenefits.com, where they can view all their policy documents and change payment types for each policy they have with National General Accident and Health. National General has a great member services department that can help with policy changes during the free look period, or change name or address on the policy at any time. They can also help with cancellations, but note, your client would need to cancel their plan 10 days before the next draft date. The dental indemnity product is a great addition to your portfolio and is very beneficial to your customers because there are 3 benefit levels to fit any customer's needs, There are benefits available for major services on the Plus plan. There are child-only plans available, and the benefits your clients receive would be a fixed dollar amount per service, making this plan very versatile. There are options for a network savings card, and it is available in a large number of states. If you have any questions on any National General product or how to become appointed with National General, please contact the email address on your screen. Thanks for your time.